the Cognivue Clarity is a computerized cognitive assessment. It uses adaptive psychophysics, which basically allows it to use the baseline motor and visual skills to set the stimuli for the following tests. As part of the Cognivue Clarity test, there are 10 subtests. And using the Cognivue Clarity in a study called the BioHermes study, which was a biomarker study of over 1,000 people, either healthy controls, clinically MCI due to AD, or clinical mild AD. The study was designed to look at the value of emerging biomarkers. So each person in the BioHermes study had an amyloid PET scan, and so we knew whether they had amyloid or not. Within there, of course, there were controls who had amyloid, and there were people who had cognitive impairment who did not have amyloid. So really, there were 4 groups of people: true controls, cognitively normal, no amyloid; preclinical AD, that is cognitively normal with amyloid; impairment due to Alzheimer's, so they had cognitive impairment plus amyloid. Then there was also a group of people who had cognitive impairment without amyloid. In studying the use of the Cognivue in this sample, we demonstrated that, of course, it was able to detect mild cognitive impairment. It was a good screener for individuals who likely had some form of either MCI or dementia. But within that study, we found there were 3 subtests: adaptive motor control, visual salience, and shape discrimination that seemed to be very sensitive to the presence of amyloid. So people who had amyloid had much worse scores in these 3 tests compared to people who did not have amyloid. And that was interesting because those 3 tests are very important to like evolution of mammals, right? So adaptive motor control basically means your ability to move in response to your environment. Visual salience is about how you can detect things in your visual environment. And shape discrimination basically allows you to think about, oh, is this a friendly shape or a scary shape? So these are very, very evolutionary rudimentary skills. And they are linked to the posterior parietal, posterior temporal, and the prefrontal cortices, areas of early amyloid deposition. So looking at that, we said, well, now we have these 3 tests that may be able to help us pick up the part of amyloid. Could we develop a measure? So we used a machine learning technique to be able to look at these 3 tests plus age, because amyloid also deposits as a function of age, right, to create the measure, which we then called the Cognivue Amyloid Risk Measure, or CARM. And we were able to then scale it from a 0 to 100 scale, because everybody loves 0 to 100 scales. And we got values, but the individual values really aren't interpretable by themselves. What we then used was using what's commonly used for biomarkers, which is using multiple thresholds. So we set the first level at 0 to 80% sensitivity. And then we set the second level, CARM2, from 80% sensitivity to Udin's index, which is basically the best balance of sensitivity and specificity. We set CARM3 from Udin's value to 80% specificity. And then we set CARM4 that greater than 80% specificity. So that we were able to then, basically look at the sensitivity and specificity of the CARM. And we found that if you were in CARM 1 or 2, you had a low risk of having a positive amyloid PET. And if you had CARM 3 or 4, you had a high risk of developing amyloid PET. So the CARM, though, is really an added value, right? So you do the cognitive testing with Cognivue, and then you determine whether someone likely has impairment or not. But you also generate the CARM, which can tell you whether the cognitive impairment is likely due to Alzheimer's disease or not. And so you can use all of that information clinically then to decide, well, what am I going to do with this patient? I might want to do biomarkers for confirmation, or I might want to look for another cause of cognitive impairment. So it has a lot of value in the clinical setting. It doesn't take the place of a clinical exam. and it doesn't take the place of doing a confirmation biomarker. What it does is allow the clinician to use all the information available at their hand, decide what's the next best step for their patient. That might lead them to a treatment protocol, it might lead them to a clinical trial, or it might lead them to a journey to find out what's causing the impairment.